Welcome to Module 1, Improving Eye Health in Complex Contexts. Module 1 is the first of the theory modules, introducing one way of thinking about systems and how to intervene for sustainable eye health improvement at a population level. This toolkit is an effort to capture our learning from the early stage systems change initiative with the Fred Hollows Foundation. It is not an exhaustive exploration of the existing theories and concepts related to systems change, but an introduction to the prominent ones that informed our decision making. It is hoped that making these underlying concepts explicit will be a first step towards a shared language within the organization and can be used to spark conversation and planning for the ways forward. Module 1 is on complex adaptive systems. This module aims to answer the question of why a systems-informed approach to eye health is necessary to achieve population improvement. The goals of this module are to define what a complex adaptive system is and why they require a systems-informed approach, introduce the Cynefin framework as a sense-making tool when navigating complexity, and discuss the risks when the approach to sustainable improvement does not take complexity into account. Complex systems are often referred to in the literature as a whole that is greater than the sum of its parts. And so in this module, we're going to talk a little bit about what that means for those of us that aim to act within complex systems in a way that sustainably improves the health of a population. In this project, our focus is on eye health. So when we think about a complex adaptive system, what is it? So first of all, it can be thought of simply as a system that is composed of diverse agents behaving independently and making decisions through their own ever-evolving process. This can include agents such as non-governmental organizations, government actors, it could be individual community members, leaders, groups. It can be really anyone or any organization or entity acting within that system. And what's important is that each of these actors is going through their own developmental process. So it could be organizational development. There could be shifts in leadership, shifts in the way they interact with their communities they serve. All of these are happening across the system at different degrees and different levels. And while all that is happening, the second part of a complex adaptive system is that these agents also interact with one another. And so all those actors are not working alone, right? They're partnering, they're communicating, maybe they're unintentionally interacting, they're aiming to serve or receive a service. And through these interactions, the result is emergence of unpredictable outcomes or dynamics. And this is an important part as we continue this module experience, is that this outcome cannot always be predicted or controlled. And so really having these aspects, these characteristics in mind. And so when we try to place ourselves in a position or a role where we may interact or intervene within a system, we really want to take into account the characteristics of these many interacting elements, that the relationship between changes in the system and the size of the consequence is nonlinear. And so that could mean that while a small intervention may be expected to have a similarly smaller scale output, that sometimes that is not what happens. And sometimes a small intervention can have a much larger effect than was expected. And maybe when looking back, we can see how that happened, how many different factors interacted, how many different unexpected events coalesced to allow this to emerge. But it's not something that could have been predicted from the outset, no matter how many experts, no matter how many discussions were held, that all of the different elements coming together couldn't have been predicted. And third, when thinking about the characteristics of this type of a system, it's important to remember that the system is also evolving with its environment. So from the small scale of all of those actors within the system to the large scale of the entire system itself, that the system is developing, evolving throughout all of these interventions. And that can be as a result of an outside influence, such as COVID, which was an unpredictable global event that in many ways transformed systems across the board in different ways that couldn't necessarily have been predicted specifically how it would have played out. What does all that theory around complexity and complex adaptive systems mean in practice as we try to apply these concepts to improving eye health? One way of looking at it is to kind of really see what might all of those different agents and actors in the system really look like when we are trying to plan for a systems-informed approach to eye health. And so here are some examples of various kind of components of a system that could contribute to the eye health within maybe a country, for example. One of these important factors could be access to care. And so even under this heading, this can be a really easy one to think of examples of different actors in a system that might be addressing this one symptom or this one area. And so there could be healthcare providers, there could be clinics really looking to address through outreach, community outreach for addressing geographic disparities, to looking at subsidized healthcare to reduce financial barriers. And this is all kind of targeting that one point in the system that can create a barrier to gaining the treatment that's needed to improve eye health. Another aspect to consider could be awareness and education. So how important is eye health to individuals at a community level, for example? Is this a priority when they have limited funds and are seeking care or seeking what they need for the family? Is eye health at the top of that list? How aware are individuals about the role of early detection and how preventable illness could be? Another aspect could be the public health infrastructure. So how are services delivered maybe to those in remote areas or those in urban settings where there's high population density? What are the limitations of data collection? How well do those people working within the system really understand what the problem is? Is the data current? Is it capturing kind of some of this nuance? Or is it very limited or old and it's hard to kind of make informed decisions? A huge one that really comes up in kind of systems change and complexity are social determinants of health. So these are kind of overreaching so many aspects, and this could be access to nutrition, clean water, sanitation, occupational hazards, like how much choice and how many resources does a population of people have to protect themselves, and then inequity in the availability of these resources across populations and groups. And another area is policy and advocacy. Policy comes up a lot in terms of sustainability of change, but how fragmented are policies? How is the implementation once there is a policy? And is that done in an equitable way? Are there the resources? And kind of what is the advocacy around public health initiatives? Is this also a priority from a political side around kind of making sure that eye health is integrated? And so you can see, even through a very general exploration of this just 5 kind of categories, that not only do these considerations exist by themselves, but even in talking about them, it's easy to see how they start to interact and they start to either maybe compound the impact. And if we aren't able to see kind of how all of these work together, we really may miss out on opportunities to have a much more sustainable intervention within a complex system. A prominent challenge in systems change and working within complexity is knowing where to start and how to hold an awareness of all of those interacting components we just discussed while making decisions, prioritizing, and doing all the things necessary to get to the stage of planning a really strong intervention. In Module 2, we'll discuss more about what intervening in complexity might look like. But while we're still stepping back and considering the concept of complexity, one helpful framework that we've used in this project is the Cynefin framework. Developed by David Snowden, this framework here is a tool for decision making as you are trying to determine the best response in a given situation. As we discussed previously, at a population level, eye health is a complex challenge due to the diversity of interacting factors contributing to the health of all individuals. This differs from perhaps the health of one isolated individual, which may be more of a medical or in a linear approach. But when we're really looking at the population and changing the way all of the factors interact to impact a group of people, we want to approach information gathering and decision making differently. As I define these different systems and corresponding response to decision making in the next slide, you may be able to identify where interventions you've been a part of sit in this framework. The framework presents 5 groupings of different types of systems we may be interacting with in any given moment. The 5th is in the center in the green, and this is the disorder category. This is when there isn't enough information to make a clear determination of what the best next step is. For the purpose of this module, we will only be exploring the other 4. So starting with simple, a simple system is a type of ordered system. When interacting here, there are known, very much agreed upon, maybe even obvious linear cause and effect relationships, and these can be repeated over time and have the same cause and effect relationship present itself. So when we are trying to make sense of how to engage with a simple system, our process is to first sense, to gather that information about what is occurring, categorize that information, and then respond based on those agreed upon categories, then implement that intervention. And this is the category of best practice. This is where best practice fits because there's an agreed upon way to approach these challenges. The next type of system is also an ordered system, but it is described as complicated. So in these systems, the approach is to sense as well. However, once the data is gathered, it may not be as obvious what the best next step is. And in these systems, it is best to analyze. And so this is sometimes referred to as the domain of experts. This is where you want to find people that have been working in this for a while to kind of really get into the data to understand the situation. And there may be good practice. So there may be multiple really well thought out ways to approach this that can have a linear cause and effect relationship, but it might not be as clear as it would be in simple and requires that expert perspective to make sense of the information of what's happening in the system. The third is the complex system, which we have already talked about. And so when working in these large complex systems with many of those actors, the approach is very different. And so rather than starting with sense, as is the first step for the ordered systems, the first step here is to probe. Because in these complex situations, there needs to be an interaction with the system in order to learn. And then the next step is to sense, is to gather that information and then respond. And it's kind of that iterative approach of engaging, probing with the system, getting information, making sense of that information, and then responding and continuing to learn through those responses. And this is the space of emergent practice, where the practice may be really unique to a particular context and requires that iterative learning from the system's response to take into account all of those different dynamics we discussed at the beginning of this module. The fourth category is chaos. And so in these situations, this is where there is an urgency that requires the first step to be act. This step is to stabilize the system, so that the next step can then be to sense what is occurring, where the system is at, and then respond. And this is the area of novel practice, where the response will be unique to this particular crisis in the moment. What's really important is that, first of all, this is not a categorization framework, which the author and the creator is very clear about. So we won't just decide, everything that we're doing is complicated and then be done. And we'll talk about that a little bit in the next slide around the risks. Very often, in my experience, when we're working in maybe public health, we're operating kind of in this area of complicated system. And so there's a lot of expertise. There's a lot of kind of discussions within an organization around how to solve a problem. But there's not a lot of kind of stepping back to consider that perhaps we are more in a complex space where there needs to be different perspectives included in understanding, kind of probing the system to identify the best way to engage within this particular context. And so this framework can be really helpful to kind of take that moment and kind of see, are we in a place where we should be kind of relying on a best practice or relying on our experts to determine a good practice? Or do we need to step back and see that we are functioning within more of a complexity space and see if there is an opportunity to use those systems-informed approaches, which we'll talk about in future modules. An important note as well is that because it isn't a categorization model, you're not always going to be acting in complex, even if you do step out. One of the challenges is just that we don't step back to engage at a level of complexity. But that once you've determined, like, this is kind of what one of our intervention points is going to be, you may shift back into simple and really apply a best practice, and then do a program plan around that, and then step back again into complexity to reassess, to sense from that probe, see what you've learned from the system, and then maybe now you'll implement a good practice and act more in a space of a complicated system. And so it is a dynamic engagement throughout the process instead of a one-time decision and then you're kind of done. Ultimately, as was presented in the beginning of this module, the eye health of a population isn't just the result of the decisions or actions of one actor within a system, but it's that interaction of the multiple actors that are dynamically changing over time, interacting with each other, all within a dynamic system that is itself adjusting to this new input and these new interactions. And so when we are trying to design our intervention, there is a risk in a mismatch in attempting to address complex issues in ways that rely on a way of thinking that is more simple or complicated, that's more linear, and doesn't take into account this dynamic nature of the complex system. And so what we can see is maybe shorter term interventions that aren't able to be sustained over time because they're dependent on that one actor to carry it out rather than being fully integrated into multiple parts of the system. And this could be a reductionist approach, an attempt to simplify a complex situation into a component part that can be addressed more clearly and more linearly, but that doesn't look at the interactions, that doesn't step back. It may also take the form of processes or procedures that rely on predetermined indicators of success. So these are already specifying what the outputs will be at the very beginning and never re-examining those throughout the process. And that can make it very difficult for there to be learning that does not allow for those unexpected and those emergent impacts in the system to be captured because they weren't pre-identified as what was being measured in the beginning. And so those processes can lead to that challenge that David Snowden discusses in the Cynefin as kind of falling on the cliff from the simple into the chaos. And that's when maybe a reliance on that oversimplification leads to a very narrow mindset about what is the boundary of what we're focusing on, what is the symptom that we're targeting, maybe correctable vision impairment or a particular surgical procedure, but that a stepping back isn't incorporated into that process. And so while we're hyper-focused on this one symptom, it allows that these other factors of the complex system to continue to interact with each other. And that can lead to chaos or a crisis as these inequities, these larger factors like social determinants of health are continuing to interact but aren't on our radar, aren't something we're considering and that we're learning from and incorporating into a continuously developing intervention that's more systems change oriented. And that's what we'll talk about in the next module too. Of course, as mentioned very early in the introduction to this module, this was a very brief introduction to some concepts around complex adaptive systems and complexity that form the foundation of our approach. For more information, here's some additional links to the articles and resources that were used for developing this module. The next module is the Systems Thinking and Change module. Here we'll define systems thinking, present how systems thinking can improve the response to population eye health, and describe systems change as it relates to sustainably improving population eye health.